Welcome back. As the start of school approaches, it means a number of things, including making sure your child's shots are up to date. Rekha Lakshmanan is the Director of Advocacy and Public Policy for the Immunization Partnership and has some definite ideas about what we all should know. Good morning.
Good morning.
How important is it for our children to be vaccinated?
Highly important. You know, immunizations or vaccines kind of play two different roles. One is to help protect the individual against disease, but another important role vaccines play is to help protect the community against disease. So think about vaccines like an invisible safety net. The more people under that safety net that are vaccinated, the higher the chances that we're going to prevent that community against a disease. And so if we start to see a breakdown in immunization rates, then it creates an opportunity for diseases that were once commonplace to reemerge.
The Immunization Partnership, what does it do? And I'm guessing that it advocates and does part of what you just talked about, trying to get the information out there about what vaccinations, the importance of them, and the value. Absolutely.
Our organization educates and advocates in the community to help spread the information about vaccine preventable diseases and why vaccination is important. Our mission is very simple. We want to eradicate vaccine preventable diseases, and we accomplish that through educating the community and advocating both at the community level as well as at the state level.
Is there a problem in the state of Texas as far as immunizations are concerned?
So the vast majority of Texans vaccinate their kids. But I would also say, think of Texas like the warm Gulf waters during hurricane season. During the summertime, the waters are prime and ripe for a storm, and that's what we're starting to see in Texas. While the vast majority vaccinate, we're also seeing a growing number of families who are choosing not to vaccinate. In fact, the Texas Department of State Health Services recently reported that in 2016-17, there were over 52,000 vaccine exemptions. And the reason why we're concerned about that number is because vaccine exemptions tend to cluster. They cluster in neighborhoods and they cluster in schools, for example. So when—
Is that like people talking to each other and they're deciding what we want to do?
Yeah, so kind of like philosophies. Right. And so what happens is if you have more and more children, for example, who are not vaccinated and they're clustering in a particular area, that safety net, that community immunity, as we call it, starts to break down, and we open ourselves potentially for an outbreak. So that's Texas's storm, is this potential vaccine preventable outbreak.
I understand that a lot of the reasons why they want to opt out is because of personal reasons, their ability to be able to do what I want to do with my child. And a lot of it is based upon what they may have heard about vaccinations and the safety of them. What would you tell people who say, well, I don't want to do that because I hear that, to vaccinate is opening up the door for some other disease?
I mean, the reality about vaccines is that if you think about it, vaccines are highly safe. They're very effective. It takes at a minimum 10 years up to 20 years of research and studying of vaccines before it even becomes available to the public. So there's a lot of thought that goes into the safety of vaccines, the making of vaccines. And even after vaccines are made available to the public, there is constant monitoring of the safety of vaccines and the effectiveness of vaccines. And what's really interesting is this monitoring of the safety not only happens with researchers and scientists here in the U.S., but it happens worldwide. So parents should feel very confident that when they take their child in or their children into the doctor's office and there's a recommendation for them to get vaccinated, that there's a lot of science and research behind them to give them that confidence to make that decision.
I'm going to put the website up, your website, because I know that would be a good source for people. Would you suggest people to go to your website to get the accurate information? Because one of the things you battle is that there's a lot of misinformation out there about what vaccines do or don't do.
Absolutely. We have a number of different resources for parents to help them do their homework and do the research and have the the right and factual information about immunizations and about vaccines. So our website is a great tool.
Have you suggested them in terms of getting their information to stay off Facebook and get it from your website?
You can go to our Facebook page, okay. And we have great information there as well. But you know, it's important for parents to check their sources, where they get their information. And you know, in addition to our website, a fantastic resource, and their first resource should be talking to their physician.
It's immunizeusa.org. Local number is 281-400-3689. I want to have everybody go to that. Quickly, legislation this past session, good or bad?
Neutral.
Okay.
I'll put it that way. You know, we have legislators who are champions and advocates, and they understand the value and the importance of vaccines. On the other hand, we also have some legislators who are unfortunately relying on misinformation and false information to make policy decisions. And it's our responsibility as an organization, and as well as the vast majority of Texans who support vaccines, to ensure that our policymakers have the factual information.
And they can go to the website as well.
They can go to the website as well.
Thank you, Reka. Appreciate you. Good luck in the year ahead.
Thank you so much.